I am Dr. Nanda Rajaneesh. I am practicing in Apollo Spectra as a laparoscopic surgeon and an onco surgeon. Elective surgery is something that individuals need a surgery and they electively choose the date and come and get operated, because if they do not get operated, there is a chance of complication at some time. So, time can vary for one person to another person, and there are different stages of disease itself for elective surgeries that happen and they need to be operated. Let us say if you ask me elective surgery in my specialty, general surgery and laparoscopic surgeries, yes, any abscesses and pus have to be removed. Let us say there is a breast abscess, I have to remove it. There is a parotid abscess, they have to remove it. There is a perineal abscess, I have to remove it. So, any abscesses and pus pockets anywhere in the body, like there is a carbuncle, I have to remove it. There is a diabetic foot, I have to remove it. So, this comes under elective, though elective surgery, it is an elective emergency surgery. So, then other surgeries like gall bladder and hernias, they are elective surgeries. And hemorrhoids, the routine hemorrhoid problems, they are all elective. Fistulas, fissures, rectovaginal fistulas, they can be elective surgeries. And many plastic surgeries and reconstructions can also come under elective surgery in our specialty too. But I will like to stick to elective surgeries of my specialty as much as possible. So, when we have to do elective surgeries, the issue here is, do I have to do the surgery in this pandemic times? So, is there a possibility that if I postpone the elective surgery to my patient, he goes into a very big complication? So, I have to look into pros and cons. Waiting, will it help? Waiting does not help. So, these things we decide, because I have to protect myself, I have to protect my family, I have to protect you, and I have to protect your family, and I have to protect every other patient and the staff coming in, working in the hospital. So, now what do I do when there is a patient who comes with the elective problem? If patient comes with a simple mild symptoms and it can be treated with a medication and I can wait for some time, we have to wait, because we are yet to know a lot about the virus. This pandemic situation is a dynamic situation, it is not constant. What I say today may not be same in another 4 months, because in 4 months, let positive side if I see, there may be some treatment, great treatment for this virus, there may be vaccination for this virus, or there may not be any of these things, and the pandemic continues, number of deaths keeps increasing and increasing. So, we do not want that situation. We do not want anybody as much as possible to get infected in this situation. This is the reason we say to everybody, stay away from the virus. But if you need an elective surgery, we are following certain criteria to handle these patients. One is, we are taking care, triage we are doing at the entrance itself, and when you meet the doctor, doctor takes precautions and you are protected, doctor also is protected. So, with all the precautions, we are seeing the patients. Then once we decide that the individual or a patient needs an elective surgery, we are doing COVID test to these patients. Okay, it has become mandatory that some of these laparoscopic surgeries and general surgeries we have to do COVID test, and we get it done and then we take them for surgery. So, but because COVID test is only 70% sensitive, we do know that 30% still patients can be positive when they come to us with asymptomatic patients who come with a surgical problem. So, we have been taught in our specialty, especially in surgical specialty, think every patient is HIV positive, because we used to say that all body fluids can transmit virus to the surgeons. So, just protect yourself from all the body fluids, and now in COVID situation, all body fluids and air also we have to protect. So, we know that during elective surgeries also there are some body fluids, there are the smoke that is created during elective surgeries. So, we protect all the staff in the operation theatre, we want to protect the patient and we want to protect the doctors also during this situation. So, we are putting certain filters in the operation theatre so that it helps, and elective surgeries, yes, we are doing when it is necessary, and when it is not necessary to do immediately, we are treating them conservatively and ask them to come back in so and so certain period. We are also doing, when patients require an elective surgery or not, to decide also we are doing consistent online consultation. So, it has been wonderful that we have such good gadgets because of wonderful software engineers who have created so many things for us. So, we can communicate, I do that a lot of times, that I connect with my patients online on WhatsApp continuously, and I also connect with the patients on video calls sometimes when it is required. This is what we are doing in our setup. And when it comes to a cancer surgery, though it is an elective surgery, we are actually doing when they need surgery now after this 1.5 month period of a very strict distancing. We started doing some of the cancer surgeries and elective surgeries too. So in breast cancers also we are doing, but whenever they need chemotherapy, first we are going to give chemotherapy and then we are going to operate them. This is how we are practicing right now. So we are here not to make profits or anything. When somebody needs help, we are here to help them.